Namaste. I'm Dr. Aman Priya Khanna from HexaHealth. Today we will discuss about how can I know if I have piles, fissure or fistula. Can untreated piles lead to fissure? Can an untreated fissure lead to a fistula? And what is the treatment for piles, fissure and fistula? These are confusing questions that are difficult to answer. To understand each and every disease which is of the anal region, I will take help of a small diagram to make you understand how the anal canal or the area of motion is made by God, so that we are able to understand these diseases. So let's understand the anal canal. This is the anal canal. There is a line which is about 3 centimeters into the anal canal, above which there is no sensation in that region. That means if there is a cut, swelling or any bleeding, I will not get to know about it. Below this line, we have sensation present. That means if there is a cut, swelling or any infection, I will feel the pain, I will feel discomfort. A fissure is nothing but a cut in the anal region. The anal region is like a ring. It opens up when we have to pass stool and it closes when we are not passing stool. If there is tight passage of stool, or we call it constipation, the anal ring tends to tear up, and this small cut or a tear in the anal region is called as a fissure. Like any cut in the body on a hand or anywhere else, we need the tear to be closed or sutured back so that it can heal up. In case of a fissure, the anal ring muscles or the sphincter, which we call, is like a ring or a rubber band like muscle. Because of the pain and the burning sensation that comes from fissure, this muscle goes into a spasm and it tends to open up the fissure. The muscle pulls both the ends of the fissure apart and it does not allow it to heal, and hence a weak scar is formed over the fissure. So the patient has a cut, feels pain, waits for about a week, 2 days, maybe 4 days, and then this weak scar is formed. This weak scar, again because of constipation, leads to a cut, and then there is a continuous cycle which we have to break. So, like we said, for any fissure to heal or any cut in the body to heal, we want the edges to come close. Only then will there be a very good healing of the fissure. For this, we need to relax the anal muscle. Now, the anal muscle is of 2 types. One muscle is in our control. That means when we want to pass motion, we go to the bathroom or the toilet and sit and we open and relax the muscle. The other muscle is not in our control. That means that the body gives us a signal to our brain which tells us that we have to pass motion, but we are not at an appropriate place that we are able to go and pass motion. To relax the muscle, this muscle is very important and it is not touched for this procedure. However, for this wound to come close, we relax the muscle with either a laser or an open procedure. When the muscle is relaxed, the wound which was open or was weak comes close, and in the next 7 days, the healing happens with a strong scar. Once the scar is healed, then there is no problem, and the fissure usually never comes back if it is done appropriately. This procedure is called a sphincterotomy. Can be done by laser or an open method. So now that we have understood fissure, let's try and understand piles. In this anal region, above the line, there are some swellings like this, which are collection of veins, blood vessel collections. When we give pressure so that we have to pass stool, these vessels engorge or become larger. So if you look at the anal region from below and divide it into time quadrants like a clock, piles are usually present at 3 o'clock position, at 7 o'clock position, or at an 11 o'clock position. These piles not necessarily have to be at all three, they can be 1, 2, or maybe all three. Because these piles are above the line, a laser treatment or a stapler treatment usually does not cause pain because of the treatment per se. The pain is like a discomfort of the anal stretch region. Like you would know, piles has grades, grade 1, 2, 3 and 4. 1 means that there is only bleeding which is painless. That means because it is above the line, piles only bleed and there is no pain in that bleeding. Grade 2 means that there is bleeding plus the mass comes out when we pass stool. However, the mass goes back on its own. It goes back on its own. Pile 3 means there is bleeding. The pile mass comes out, but we have to push it back in. And a pile grade 4 means that there is bleeding, but the mass stays out and it does not go back in. With these stages, that is especially with grade 2, 3 and 4, because of the size of the mass and the other complications that happens in these vessel collections, the patient might have pain or some kind of swelling in the anal region which is causing trouble and discomfort. So coming to what are the treatments of piles and how we are able to solve them. A laser fiber, which is like a thin wire, goes inside and destroys or stops the blood supply that was creating the pile. Once this is done, the pile reduces in size at whatever position it was earlier and usually does not come back. So there is no cut, there is no dressing to be done, and the patient, like I said, is usually able to join back work on the 3rd or the 4th day. Coming to stapler, also known as MIPH, that means minimal invasive procedure for hemorrhoids. So stapler, what does it do? A stapler is a device which is inserted in the anal region and it has a cup. The pile mass, which is above the line of sensation, that means there is no sensation there, is sutured, tied together, and the stapler is fired. Once the stapler is fired, a pile mass donut or a vada comes out. Now this pile mass donut has the pile which is at 3 o'clock position, 7 o'clock position and at 11 o'clock position. Along with that, the other positions which might or might not have a pile are also taken out. So the chances of it repeating are very, very less as compared to laser, because in laser we are only doing laser at 3 positions and the rest of the position is still there and the pile mass can come in that location. However, not to complicate things, each type of procedure is different for each patient. Some patients really benefit with laser, some patients really benefit with stapler. The important thing to note is that neither in laser nor in stapler there is an external wound. That means there is no dressing, there is no external wound that will bleed. Because there is stretch in the anal region, the patient is in discomfort for about a day or two, and patients usually join back work on the 3rd or the 4th day. Some patients take about a week depending upon pain tolerance.